Admitting everybody now. And Mike, you're all set.
Good morning, everyone. Thanks for joining us. Really great topic and presentation this morning. My name's Mike Skelton. I'm the CEO of the Greater Manchester Chamber of Commerce. And I want to thank ExcellenceNorth Alliance for partnering with us on this program. You know, we're at this interesting inflection point in our communities and our state where everyone is slowly moving back towards finding what that new normal is and reopening businesses and organizations and institutions. And on behalf of the chamber, you know, we're very interested and excited to try and offer as many resources as we can to our members and to the community about how to do those things the right way, how to do them safely, how to do them smartly, how to do them in a way that'll be successful for our businesses and institutions. So I think we have a great program this morning to provide you some resources on that front, and to talk about the program, to moderate, and to introduce our panelists. I'm going to throw it over to Brian Hetrick from ExcellenceNorth Alliance. And again, I want to thank ExcellenceNorth Alliance for being our partners and helping bring this program together and to our community this morning. Brian, take it away.
Thank you, Mike, and hello, everyone. I'm Brian Hetrick. Pleased to be with you today, hosting this important webinar on Think Safe, Act Safe, and Feel Safe. All about how to successfully navigate the path to reopening your business through this COVID-19 crisis. Just a short blurb about the ExcellenceNorth. We are a nonprofit, part of a nationwide public-private partnership. We're dedicated to improving the performance of businesses, organizations, and communities through customized training, coaching, and assessments. Specifically, the ExcellenceNorth Alliance helps organizations and communities identify and follow their unique pathway to build and sustain success for the long term. And we'll be offering other opportunities later this fall. Right now, though, we have with us two renowned experts in their fields who will be presenting this webinar, and it's my pleasure to welcome them and introduce them to you right now. If you do have any questions, please use the chat feature, and we will be taking and addressing them during the Q&A. So first is Ashley Conley. Ashley is the Director of Infection Prevention at Catholic Medical Center here in Manchester, New Hampshire, and received her MS in Infectious Diseases and Microbiology from the University of Pittsburgh. She is current president for the New Hampshire Infection Prevention and Epidemiology Professionals. Thank you for being here, Ashley.
Great, thank you so much. It's my pleasure.
And next is Charlie Garland. Charlie is an independent innovation and business strategy consultant who works between New York City and Cape Cod, helping organizations grow and thrive through a wide range of business challenges. He graduated from Dartmouth College's Tuck School of Business and serves on several nonprofit organizations, including as a board member of the Creative Education Foundation and as a senior fellow with HIT Lab at Columbia University Medical Center. Welcome, Charlie.
Thank you, Brian. I'm happy to help out. And the next slide.
Yes. Well, the first thing we'd like to do is set up the current situation and get us all on the same page with how this presentation is tailored. And we'll kick things off by having Charlie lead us through the agenda. Charlie?
Thanks, Brian. Here you can see what we have today's presentation set out in a few different phases. Number one, we'll have an introduction to the current situation, which we're all fairly familiar with. And we'll take a closer look next at the challenges that face all of us. The third thing we'll look at is how we should be envisioning the path forward, or the paths forward. The next thing is a walkthrough of a real life scenario, planning to reopen a business. And in this case, we're gonna use a restaurant as a case study. The next thing after that would be applying strategy and innovation tools along with health and safety knowledge to help guide the way. Following that, we'll be introducing you to what we call our reopening roadmap and how to take next steps with it. And then of course, we'll have a Q&A for the panel.
Thank you, Charlie. And let me also just reiterate that throughout the presentation, please feel free to open up your chat window and type in a question or comment for the presenters during the Q&A.
So one of the first things we need to be clear on is the complexity of the problem in front of us. Now, Ashley, perhaps the most daunting part of this is this extraordinary nature of the disease, how serious and contagious it can be, and still how little we know about it.
Yes, that's really a big part of it. So let me walk us through this big picture here to start. So of course we know we've all come from this old normal where before the pandemic hit us, we had our everyday lives, going to work, going to school, all those things. And now we have this pandemic that we're dealing with, and everyone's trying to figure out what's going on. And we're learning virtually every day more and more about this disease and how it behaves, in that public health context. One of the major problems here is that the situation is very fluid. It's changing day by day and also region by region, as we're seeing, in the news even today on how that's changing across the country. So we acknowledge that we're not facing just one wave, it could be another wave. It's really hard to know. And I know I wish I had a crystal ball here in New Hampshire to know what's going on, but we do know it's affecting, our population across the whole country. And because of this, we know that full recovery may be a little bit away. And as you can see in this middle part of our diagram, we have some of those core public health elements that we use to respond to a pandemic like this. One is our pharmaceutical interventions. So those might be our vaccines or our treatments for patients when they get sick. And then there's those non-pharmaceutical interventions, which is what many people are familiar with. It's our wearing masks, it's using some personal protective equipment, maybe like gloves, it's the social distancing, keeping space between people. All those things are those non-pharmaceutical interventions that we try and implement to reduce that risk. And like many other public health crises that we have, we learn a little bit more every day on what works best. Yeah, it's gonna be, we have to hang on and see where exactly this is going to ride and see what that new normal is going to look like.
Yeah, I hear you. So what you're saying here is that nobody really knows how quickly or completely the crisis will be resolved, or even if it can be in one steady and predictable process. And that's according to the world's leading experts, right? So that gives us all a picture that we really all just don't know what we don't know about the recovery cycle here. And just as a real-time clarification for the audience today, you should know that we created this slide more than 2 months ago, and that was before the nationwide protests began and some states decided to try reopening early, yet this very same unknown element still exists today as we'd previously expected, not realizing what was about to take place. So this really speaks to the importance of this new way of thinking that we're emphasizing here. For example, we'll put a link to an article that demonstrates this, one that we found, which was just published last Tuesday in the Union Leader. But either way, let's take a look at some additional issues that we need to be aware of. And let's take a look, next slide, thank you. Okay, so here we see yet another dimension of complexity, unknown layered onto the earlier scenario. Now I realize this is really difficult to read in this form, but let me just summarize it by saying that we face a compounded complexity around how the pandemic will get resolved. This is because we not only face the unknowns around the public health interventions that you described earlier, Ashley, but we must also take into account the interventions taken at the governmental, economic, and social levels. What they're showing here basically is a range of recovery scenarios that are likely given the effectiveness of these different types of interventions. And that makes it all the more challenging for public health leaders like yourself, correct?
It certainly does, Charlie. And, a lot of the variables might be out of our control, especially from the perspective of a business leader. And what we realize we have to do is really be hypervigilant and adaptable. We need to stay on top of that changing, unpredictable scenario that we're faced with. So every day we have these unknowns and we have varying levels of risk depending on the day. And the last thing we should really be doing is, falling back into old familiar habits. And what I like to call it is more that muscle memory. It's those behaviors that we tend to do so much, we just do it automatic. And an example of muscle memory, especially one that we use here at the hospital, is about taking off a dirty pair of gloves. You know, it sounds really simple, but if you've gotten in the habit over time of taking them off incorrectly, then they have that chance they're contaminating their hands in the process. So there's a correct way and an incorrect way to take off those gloves. And if they're doing it incorrectly, it can be really hard to correct that muscle memory and to change that muscle memory after you've been doing it for so long. That same thing happens when you wash your hands. You know, where I work, we use a product called Glow Germ that you put on your hands, and you go and you wash your hands, and then you take a black light and you see all the areas that you missed. And that's another muscle memory, right? You wash your hands so many times a day, you don't even think about it, but there may be spots in your hands that you're missing. So how do we retrain ourselves and change that muscle memory? So it's not uncommon for us to be battling these things, especially now in all sectors, especially the business sector with our staff. So what are some things you can do, you know, to create a new muscle memory to reduce risk in your staff and keep them healthy?
Well, I definitely agree with that. So what that raises is the question of how do we, as business leaders and business owners, deal with all of this complexity and unknown? This is a scenario that is often referred to as a VUCA world, where the acronym VUCA refers to volatile, uncertain, complex, and ambiguous. What resources are available for us to be successful with business here, yet at the same time actually be safe as we move toward recovery? And the next slide. So in spite of this enormous set of challenges we face, we can begin seeing the path forward through the lens of a much more logical, disciplined process of problem solving. In this case, we can introduce an approach that utilizes proven methods and tools that will be helpful in any organization with taking the most confident and reliable steps forward towards successful and safe reopening of their business. So what we see here is a basic framework for approaching this very type of VUCA challenge. Some of you may be familiar with the 4 phases of the standard creative problem solving, or CPS, process. These essentially include the following. First of all, clarify the current situation, understand the context, the stakeholders involved, the values they hold, the resources available to you, and ways of utilizing those resources that can create value for all stakeholders. In the clarify phase, we work towards defining the problem. And then ideate new and unique ways of utilizing the resources that are available to us. Discover ways of making other resources available for our use, and identifying risks and obstacles in the process. In the ideate phase, we identify the best candidates for a solution to the problem. Then develop the specific solutions to each problem that fit within all our real-life constraints. Here, we begin putting together prototypes, draft designs, and other things that we can actually try in real life. In the develop phase, we produce and fine-tune the actual solutions. And then finally, we implement the solution into the real-world scenario by introducing it into actual places with the actual stakeholders interacting with them. In the implement phase, we refine the solution so that we can see if and how it works reliably in the real world.
Yeah, that seems to make sense to me, Charlie. And, you know, we follow a similar process at the hospital where we do what you lay out here. We brainstorm and identify a problem. We work together as a team with others to follow the protocol. But can you tell me again, what's that funny looking cube-shaped thing at the top?
That is what is commonly called the Innovation Cube, or a tool that I just call QB. Now, QB is a logic model developed over a decade ago for innovation, strategy, and design that helps guide you toward new thinking, to ask a lot of questions, and to make sure you have the best chances to have the information that you need to solve the problem. This is information that we as humans often tend to overlook and experience what we often call blind spots. So QB works to pull that new useful information out of us, eliminate our blind spots, and help us to navigate a highly complex problem scenario. This tool is used throughout all phases of the creative problem-solving process. Put another way, it helps reduce the risks that we all face that are created from the unpredictable challenges around us, as well as our own basic shortcomings as human beings who suffer the effects of confusion, cognitive bias, excessive workload, mental stress, and more.
Yeah, and I know if I had a question at a quarter for every question I get asked at work or have to ask to think outside the box, I think I probably could have retired by now. So that's one aspect that's really so helpful. And when we are faced with recovering and responding to a pandemic at the same time, which is what I think we're doing now, we need to be able to identify all the processes that need to be changed or modified to ensure that our customers and our staff remain healthy, and then we can all move past this pandemic. It's not going to be like this forever. Here at the hospital, we've been tasked with a lot of challenges that we've had to overcome. We've had to respond to a lot of different scenarios. And to do that, we've had to gather a lot of information from our stakeholders and then work together as a team to be able to overcome them. And when you think about customers, for us, it could be a lot of people. It could be patients, it could be our vendors that come in, it could be community partners. So there's a lot of different people that we here think of as customers. And we have to ask question after question, identify what's going to be the best process to move forward. And it's kind of like a 3-year-old that can't stop asking why, right? Why? Why do I need to change this process? And why are my customers expecting us to change to reduce disease transmission, or why not? I think the overall goal is really to reduce risk and provide the optics for our customers that they see us reducing that risk during the pandemic.
Yes, Ashley, absolutely it is. And I think we can show others today how the same discipline approach can be used to, in fact, resuscitate their business. So maybe it's time we delve into the real life scenario we mentioned earlier. How do we help a business owner navigate through the scenario of opening up their restaurant business? Well, what we did is we interviewed a few folks who were involved in the restaurant industry to better understand the kinds of particular challenges that they are having to deal with now. Some of these are very specific to a restaurant business, but many of them are quite generic to almost any business: retail, corporate, manufacturing, education, tech services, and so on. But we tried to find out what it was like in a typical day in the life of that business owner, assuming they were running their business in the normal way some time ago, and how they now believe they'll have to run it during this transition period to some new normal. We wanted to find out how they were thinking about how they would recover and what they thought that new normal might look like. And here's what we found. So it turns out that the owner and the answers that this owner, and we'll call him Sam, gave us were rather similar to the way things were before, but just with a slight few modifications in terms of how tables were laid out, the PPE that employees were required to wear, and some signage that they planned to put up to remind customers about social distancing. Pretty much all the answers they gave were good, reasonable answers. Now, however, it became clear fairly quickly that they had not really asked themselves nearly enough questions about what else might be really important to do and to have in this new situation. So if you recall from the earlier slide, we showed the 4 phases of that creative problem-solving process. Now remember, the first phase is where you explore the context of your current situation as a means of helping you precisely define the problem. Some of the most important things you can do during this phase include thinking carefully about all the basics of your business and asking yourself questions that challenge your assumptions about what that old normal was and what the new normal might be. So here you might want to get a feel for things like all of the characteristics of the environment you're working within, as well as all of the major stakeholder types you'll be interacting with, including all of the needs, motivations, values, fears, and concerns that those stakeholders have. Ask yourself, what are all of the resources that you'll have available to you to meet or exceed those stakeholders' needs? And include, beyond that, all of the different ways you might use those resources to accomplish what you want to get done, and so on.
Yeah, so Charlie, when I think about this process and I think about what the businesses are working to reopen, there are just many stakeholders that they all have to work with. As I mentioned, in healthcare, we have our patients and staff and our visitors and family members and community members. But then another customer that we have and that business might have are, the state health department. some businesses may face a staff member that becomes sick with COVID, or maybe they had a customer that developed COVID after their visit. And that could really just change how they have to operate for a time, once that's identified. And they'll need to work and partner with the health department to work through it and make sure that everyone's healthy moving forward. So there's really a lot of things to think about, which if we start thinking about it now, it'll help when that, that eventually becomes something that happens. So Charlie, do you think it's really necessary for every business owner to go through this exhaustive process of naming all resources, all the stakeholders and more? Seems like it might take them a while.
Well, no, actually, of course, it's not really necessary to name each and every last element of the current or the future scenario. And you're right, that would essentially take forever. But what is extremely important here is that every business owner make a point of thinking way beyond what they'd been used to in the old normal and begin thinking about new ways of doing business in this ever-changing and very new normal that we need to get in front of. We cannot afford to bear the risks that we face if we were to rely predominantly on that muscle memory behavior that you'd mentioned earlier. That may have served us well in the past, in fact, but in this present and in the next new normal, it represents a real threat to how we work and whether or not we have the ability to survive, let alone thrive in the future. So I'd say that this new type of thinking is absolutely vital for our ability to navigate our path forward. And no, we don't have to think of everything, but we really need to think much more carefully and do so consciously.
Yeah, I absolutely agree with that, Charlie. And I know we've had to do that here at the hospital too. So, all right, let's go back to our restaurant owner example. How does this sort of thinking apply?
Well, it seems as though this owner didn't take the same sort of approach we're describing here. What he essentially did is he left most of his reopening plans to be fairly similar to the way they did business before. In terms of his environment, he was thinking mostly of his physical restaurant, equipment, and so on. He realized that he'd have to move a few tables around and take some away and put up a number of signs throughout, as well as on the outside of the facility. And he did think about his employees and his regular customers and doing a lot more cleaning and disinfecting to keep everyone safe. In fact, he mentioned that he had found online a reopening guide published by the CDC, and he planned to follow all those instructions very closely. So by doing that, he felt quite confident that he would be doing all the right things. He also expressed concern that he may not be able to meet all his expenses, especially rent, with the smaller number of people he'd be serving. And he didn't think that takeouts or deliveries would be able to make up for that. So he doesn't think that he's in the greatest shape to reopen at this stage.
Yeah, I think in this example, it sounds like he probably could have done a little bit more deeper thinking about all those different things we had talked about previously. How about if we run through the scenario, but this time we'll use the logic flow that you laid out before?
Absolutely. So that's a great idea. And we'll do so using that innovation tool that we mentioned earlier called QB.
Oh, good. I was wondering when we could take that and really put it into play. So how does it work?
Well, remember the stuff we mentioned the business owner needs to think about in following the problem-solving process, the characteristics of the environment. Exploring that involves asking questions about what things are and where they are in relation to each other. Thinking about stakeholders is exploring the question who and who else. Understanding their needs, motivations, and feelings is asking why type questions. Considering available resources is again asking what exists, and exploring unique ways of using those resources to get positive results involves asking how and probing more and more through asking how else.
Yeah, and I think, that's the trend. It's what, where, who, why, and how. Those are those universal questions. And it sounds like we're really trying to help business owners cover all the bases, making sure they're considering all the different options they have to solve their problems, or at least give a lot of opportunities to use this tool. And I feel like I've had to think outside the box a lot the last 4 months as we've had to navigate many different challenges within healthcare. We've had shortages of PPE or that personal protective equipment. We've had to care for patients without their family members here. There's been a lot of fear and anxiety of the unknown, especially from staff. And for each and every decision that we've made, we've had to ask those questions of the who, what, where, how and why. And with this innovation tool, it really seems like we're helping people think outside the box in a lot of different directions, which can be so helpful, right?
That's 100% correct, Ashley. And I know a lot of people are sick and tired of hearing the term think outside the box. Quite honestly, I am too. But that's exactly what QB does. It reminds you to explore all your options and in multiple dimensions. It helps you to go way beyond your muscle memory behaviors. So let's take a closer look at that QB model now. Excuse me. Here we have the faces of the model laid out flat so that we can see them all at once. And in the picture below, this is how it's used often by someone to hold up and show different faces that prompt you to ask those questions of different types or explore that particular dimension of your problem area.
Yeah, and it looks like a great tool for brainstorming. It helps you come up with a lot of new and different types of ideas, which is just so important these days. So can we use this tool right now to help Sam, our restaurant owner, make a better plan for reopening?
Definitely. And of course, we've already done a lot of that brainstorming in the background. So let's describe what new insights QB helped us come up with. Exploring the stakeholders, we began realizing that the folks who could be patronizing Sam's restaurant are not just his regular customers. We asked who else might be a prospective new customer. Well, people who have never dined at this restaurant before, people who live in neighboring towns, people who might be traveling through the area temporarily, people who are friends of his regular customers, who might also come as guests.
Yeah, and of those possible new customers, as well as the regulars, of course, they may have fears and concerns about safety. You know, I've seen both types where people are very concerned, some are not concerned, and you really have to cater to both. So they're probably, some are hesitant to go out to eat because they believe there might be a risk for catching the disease, either from a staff member or from another patron that might be there. They may be concerned about a piece of furniture or the table. And all those concerns are valid, you know, especially if they believe that the restaurant isn't taking all those precautions. They don't see them taking those precautions. And, you know, if they were at home, they might be taking those precautions. So if that's the case, these potential customers, you know, when they feel this way, why would they even go in Sam's restaurant, right? They probably would consider maybe just staying home and cooking at home, right? So what good is all that extra cleaning and disinfecting Sam might do, even if you follow the CDC guidelines to a T, right?
That is a great observation. And you're absolutely right. Why would a customer take the risk to herself or even the rest of her family's health if they don't feel safe going out to a restaurant? Those insights can become apparent by continuing to ask probing questions, such as why might a prospective customer either come or not come to this restaurant during the COVID-19 crisis? But what we have here is the opportunity to change that. We continue using QB to ask Sam, what resources do you have available to you? How might you uniquely use those resources to create something new, something that could change the way a prospective customer feels about dining in your restaurant? And how might you change their feelings at the right time, which is before they make the decision to do something else, like go to the grocery store and shop for a home-cooked meal? Beyond that, how might you do this when they are all in different locations and you're just right here in one place?
Yeah, those are really great questions to ask. And how do you even get their attention in the first place? I know personally, there have been some stores and food establishments that I've gone to where you can tell they've really thought through all the different prevention measures. You can see it, I can hear it in the staff voices, and it really makes you feel safe and feel safe. And then there are some where I think they might be struggling a bit more with how to really implement that change and have that change sustained. So with the restaurant example we're using, how can they change someone's fears about the safety of their restaurant?
Well, those are very reasonable concerns, Ashley. But again, we have a few tools that we can use to help Sam come up with an innovative solution to his challenge. And by asking ourselves what exists that we know about, or that we know others have used in the past or in different scenarios, even outside of what's typical for a restaurant to use, that might be of some value to us. How have other people solved problems that are somewhat similar to the one we have here?
Yeah, and I know one thing that really comes to mind for me is that Sam could communicate to his folks, just how carefully he's thought through their safety. Maybe he can let them know he's gone, above and beyond to prepare, to make it as healthy as possible. Maybe he could show them precisely how well his staff cleans and disinfects everything, every surface, every aspect of it. I know that here at the hospital, we're doing things like taking temperatures when we have patients or vendors or visitors coming into our hospital. So that's a great way for people to see right up front that, we're taking this seriously, we're going to ask these questions and make sure that, before we let somebody in, that it's safe to do so. With Sam's example, maybe he could post videos of his employees doing the cleaning, or he could double to make sure that the cleaning's going well, at his restaurant. Here at the hospital, we use that glow germ I mentioned earlier, and we'll actually use that to check, are we really cleaning and disinfecting properly? So we'll make sure that people are actually hitting all the core areas and do an audit or a check, which is something that, Sam could also do at his restaurant. And a couple other things, Sam could maybe post their plan or their actions they're doing on his website or his Facebook page. Here at the hospital, we have our internal policies that our staff follow, but we've also posted to Facebook and our website things that we're doing so that people can see that. So with Sam, he could do some of those things to make it safer and then also show that he's making it safer for his customers.
Yeah, those are great ideas, Ashley, and I can see that they all come from currently available resources. You've simply come up with an intriguing new way to use them to create new value for the customer. But how would Sam get these in front of the folks he wants to attract to his venue? He doesn't even know who these people are yet.
Yeah, and that's where I think you have to think outside the box just a little bit more. And I think that's how we continue to use the QB to develop, a solution to that challenge. One of the first ways I think Sam could do this is to start with his regulars, people that know him well, who've already signed up for his mailing list or said that they'd be interested to hear about specials or menu changes. If you could get information out to those customers in an email, then that would be one great way to start. And another thing too would be to get information back from those regular customers. So here at the hospital, we've actually have patients on a panel that help us make decisions on that patient experience. So Sam could do something similar where he could reach out to them, tell them what he's doing, and then get that information back. And another thing is he could create like a secret recipe for safety, a document, make it fun, right? Secret recipe, isn't that a fun ploy on being a restaurant and then saying what you're doing to keep things safe? So that's fun. And the more we can make it exciting for both staff and our customers, the more people are going to feel safe. So I think with Sam, offering maybe even specials to bring those friends in or guests or giving them a free bottle of wine or, what other things we can do to try and get people to come on in.
Secret recipe for safety. I love it. That's a great idea. Ashley, I think those just might work.
Bon appetit.
Okay, so I realize this is just one small example of how, of how the QB model works and how we've helped just one business leader to use some new thinking along with a structure of something like a creative problem-solving process. And you could use something else like design thinking or Lean Six Sigma or something like that. They work just as well. And to help this individual address at least one of the challenges he's facing. The same approach can be used over and over again, just by going through a few basic steps and asking yourself and asking others around you to explore their imagination and come up with some new ideas. It's really not that hard. It just takes discipline and access to some of these resources. In fact, we've already thought of an additional 10 more innovative approaches that could be developed to help this same business. We just haven't described them all here for the sake of time.
Yeah, and the great news is that this very solution that we talked about here in the webinar might not be just for a business owner. It can really be for a wide range of businesses. It can be adapted and used in many places. So what are the resources that we can share with everybody today? Not just to resuscitate their business, but to truly reinvent their business.
Well, they certainly can, actually. And what we've done is we've made a couple of these downloadable from the ExcellenceNorth Alliance website. These are all being made available today for free.
That sounds great. And afterward, what if somebody has trouble using them? Not everyone here might be an expert in innovation and problem solving, or even some of these other issues around listening and making videos. Are there any additional resources they can go to so that everyone can really think safe, act safe, and really authentically feel safe?
Definitely. And here's what they can do. First and foremost, they can contact ExcellenceNorth Alliance for any of our presenters today and make an appointment for, let's say, a half-hour private consultation. Of course, that would be a free session. They can also submit specific questions to ENA versus email, and someone will respond to those within 1 or 2 business days. And finally, they can download and review that 2020 reopening roadmap document.
Well, thank you, Charlie and Ashley, for that great information. And we do have a couple questions that we'd like to present back to you. The first one was, this looks great, but I'm not running a restaurant. Will this approach still work for my professional services business? And if so, what might that look like?
Well, I guess I could take that. So it really, I think as we mentioned earlier in the presentation, the very same structure can be used no matter what the business is. So for a professional services firm, you still have stakeholders that you have to worry about. You have customers and perhaps regular customers or past customers, but you also have future customers that you don't know about yet. And you have future customers that don't know about you yet. So you can be very innovative and creative and think outside the box about how to get your message across to those people. And you can do it in a conventional way, or you can do it in a very unconventional way. We talked about the example of how Sam, the restaurant owner, used friends of his regular customers to pass the word along to their friends, you know, just sort of like piggybacking on the goodwill that he has with his past customers. Certainly any business can do something very similar to that. But there are other ways of getting to new customers, for example. That might be something like doing presentations at an industry association or a chamber of commerce, which is more geographically oriented. It could be that you want to think of new ways of creating services that you haven't created before, because you have to appeal to a whole new set of customers and customer needs. So there certainly are any number of ways of doing it. It really just happens to include going through the system of looking at your process, looking at the context and your environment, understanding the problem, defining the problem carefully, and asking a whole bunch of questions about all the different aspects of your business and your business environment.
Okay, thank you. The second touches a little upon the first one, but it has a slightly different aspect to it. It says, this seems like great material, but I have no experience running this sort of business planning and strategy process. How can someone like me and my team work with this if we've never done it before?
Well, again, I would say in that case, first, at least download that roadmap document, the reopening roadmap, because that spells out pretty much step by step, not really what to do, because we don't know your business, but what we can do is we can help you ask the right questions. And once you ask the right questions with the knowledge that you have about your business and the environment, that will bring forth a lot of answers that I think you're looking for, or at least suggestions of where to look further. It could be that you don't get the answer right away, but you get an idea of where to look next, where to find out more information, who to ask, who else to consult, and how to get details about things that you really never have had to think about before. Obviously, another way is to contact the ExcellenceNorth Alliance and get in touch with one of their resources or myself, which I've made myself available to consult with folks on a one-on-one basis and really answer any of your questions that you have to, this is what I'm worried about, this is what I'm concerned about, this is what I've tried and it hasn't worked, what else can I do? Those kinds of things are absolutely fair game. And I think both myself and Ashley, especially when it comes to things like like public health are very willing to help you get started and help you move forward.
Okay, great. Thank you very much, Charlie. And also I'd like to thank I don't see there's any more questions. So I'd like to thank our presenters today, Ashley and Charlie, for sharing such great pertinent information. Thanks again to the Greater Manchester Chamber for hosting today's webinar, and a special thanks to all of you who attended today's event. Have a great day.